Well, good morning. Thank you for coming. On behalf of the 750 members of the South Carolina chapter of the American Academy of Pediatrics and my colleagues at the podium, I want to thank you for coming and hearing our message. We are here today to address the issue of protecting the children of South Carolina during a serious update in the COVID-19 pandemic. This is an unprecedented step for this organization, the South Carolina chapter, but worthy of our calling as pediatricians to always put the safety of children first. My name is Dr. Bob Saul. I'm the president of the South Carolina chapter of the AAP. I live in Greenwood. I'm a pediatrician in South Carolina for over 42 years. I'm board certified in both pediatrics and medical genetics. My career has provided care to children and families of all children and families. Those in routine care, those with genetic conditions, those with high-risk social situations, and those with medically fragile conditions. During that time, I have seen serious and often fatal conditions, ones that I saw during my training, disappear. Why? Because of vaccines. Those diseases are now preventable. We want COVID-19 to be in that same class. But in the interim, we need to protect our children. Perhaps the most compelling reason for being here today is to emphasize that we want children back in schools. This is something we all agree on. Why do we want our children to be back in schools? Well, as their pediatricians, we know that children need so many things that schools offer. Education, learning, socialization, mental health services, counseling, such as sports, bands, to name a few, nutrition services, protective services, and so much more. Parents can go to work reassured when their children are safe and protected in their schools. We saw what happened last year during the school lockdown, during the height of the pandemic, and we do not want to see that happen again. We want our children back in schools. However, if we want them to stay in school, we must take measures to help them stay safe and healthy.
Good morning, everyone. My name is Dr. Debbie Greenhouse. I'm a pediatrician in private practice and a past president of the South Carolina chapter of the American Academy of Pediatrics. In a time when misinformation is more contagious than COVID, here are some facts from the people that you trust to care for your children. Children below vaccination age should be in masks when they are inside and in close proximity to others, including in schools and on school buses. In a non-household group of both vaccinated and unvaccinated children or adults, everyone should be masked when in close proximity to have maximal protection. Vaccination for eligible children and adults and masking greatly reduces the risk of transmitting the highly contagious Delta variant of COVID. We recommend COVID-19 vaccinations for children above 12 years of age. We also recommend COVID vaccination for parents, grandparents, teachers, and everyone who interacts with young children. Masks and vaccines help to protect our children. When it comes to your child's health, please don't rely on social media for advice. Ask a healthcare expert who knows you and who knows your child, your pediatrician. We believe that safe, in-person learning is the best for all children. Scientific studies demonstrate that masking does not cause negative effects on either mental health or on learning. Thank you.
My name is Dr. Annie Andrews, and I'm an associate professor of pediatrics and a member of the South Carolina chapter of the AAP. The Delta variant of COVID has changed how we must think about this disease in children. Despite public perception, anyone can be infected with COVID, including newborns, children, teens, and young adults. It is not just an old person's disease. To date, over 4 million children and adolescents have been infected with the virus in the U.S. Last week alone, over 121,000 children were positive in the U.S. The risk of death from COVID among children is low. However, it can cause serious disease and long-term adverse health effects. It is up to us as adults to do everything we can to prevent COVID infections in the children of our state. Vaccines for those old enough and masks are the key elements of prevention at this time. Our position on masks and vaccines is supported by the CDC, the South Carolina Department of Health, and the American Academy of Pediatrics. Universal masking for children in schools provides maximum protection from infection. This is especially important now when children under 12 cannot be vaccinated. The large majority of older children in our state have not been vaccinated, and infection rates are increasing rapidly.
Good morning, my name is Leslie Jackson, and I'm from Charleston, South Carolina, born and raised in Lexington, South Carolina. In November 2016, I gave birth to 24-week twins at MUSC. They spent a combined 400+ days battling the worst chronic lung disease and pulmonary hypertension. One came home with a feeding tube at 5 months old, and the other 11 months with a tracheostomy, ventilator, oxygen, and feeding tube. I'm proud to say that they are now 4 years old with no medical devices and attend public schools. My boy's recovery is nothing short of a miracle. Our story isn't much different than a lot of medically complex families, but we all share a common bond, going through some very traumatic times in our lives, watching our children fight every day to stay in this world with us. We often band together to support each other, and even if you don't know us, we're in your community. COVID-19 has unfortunately turned the world for medical families completely upside down. For my family, it's our worst nightmare. A respiratory virus that attacks the lungs and other organs of our bodies. My mind was racing with questions and concerns. My boys are recovering chronic lung disease micropremies. Were they strong enough to combat this deadly virus? At the time, one of my sons were just 6 months post-airway reconstruction surgery. Was he gonna be strong enough to fight this virus? What about myself? I'm an asthmatic. Could this kill me too? If they didn't get sick, and if they got sick and had to be hospitalized, will my husband and I be separated from them? We've never been separated inpatient before. I even started to have nightmares about our trauma of what my boys went through. These dreams consisted of hearing alarm bells, my baby's eyes wide open as he gasped for air on a mechanical ventilator, reaching out to me as if begging me to help him. Stolen, paralyzed ventilator from 80s to 100. Other families questions and just as helpless as I did, how we found things critical home therapists so their children won't regress. It really affects kids mentally and emotionally. How do we protect them? And now our hospitals are filling up. For most of us, medical families, the hospital is ours and our only plan B. It's terrifying for us to know that when our kids get critically ill or hurt, we can't take them to the place we know can save them. Medical families know firsthand about a small piece of material that cover our noses and mouth and is one of the best defenses for us, a mask. Lots of medical families have used masking along with good hand washing practices for years to keep deadly viruses and illnesses away. And guess what? My kids can breathe just fine in a mask. But with COVID-19, it takes more than just masking ourselves and our children to survive this virus. We need our community to help protect us too. It hurts to see so much fighting. A historic vaccine made in record time to help people survive this virus. We've made the decision to give our children experimental medication to survive another day. We also know that vaccines aren't always the answer for our kids. For example, some kids don't make antibodies after vaccination. It makes us feel as though we aren't a valued part of our society. Why? Our children have overcome more than most adults have, and all we want is a chance at life. Whatever that life looks like, we want it for our children. We also do not want another family to go through what we've been through. We don't want our friends, families, and communities to go through trauma that we had to go through. We don't want to see your kids gasping for air for their breath, struggling to breathe. We don't want to see you having to see RTs, doctors, put a breathing tube into your child, hooking them to a ventilator to keep their lungs open and working. We don't want you to see your child paralyzed and only knowing they're in pain or discomfort by a lone tear that falls from their eyes. And also, we don't want to have to feel the heartache of losing a child. To our medical families, to our medical teams, to our healthcare workers working the front lines, thank you. We see you. We see the fear and worry in your eyes. We see the exhaustion, we see the fight. Please wear your mask. Please get vaccinated if you can or if you choose to. If not for yourself, do it for medical families like us. Thank you.
Good morning, everyone. I'm Dr. Linda Bell. I'm the South Carolina State Epidemiologist and the Director of DHEC's Bureau of Communicable Disease Prevention and Control. I want to thank you for including me today. I wish that this event wasn't necessary, but given where we are now, it is. I am certain that when history is written, people will look back and wonder at how we were nearing normalcy, then had a dramatic resurgence in this disease given all the tools we had available to prevent what is unfolding right now. I want to emphasize the means that we have to keep our children safe for in-school learning this year, something that we can all agree on that we need and that we want. Earlier this year, the Centers for Disease Control and Prevention published findings from studies of COVID-19 transmission in K through 12 schools. And in one report, during 13 weeks of in-person learning, only 7 of 4,872 students and 0 of 654 staff members got COVID in a school setting. However, DHEC posted our COVID-19 associated cases in students and staff on this past Friday, and in less than 2 weeks of in-school learning in South Carolina, 141 students and 34 staff were reported with COVID-19. Some are having severe complications. We have more cases in South Carolina in schools in less than 2 weeks of in-person learning than were found in 13 weeks in the published studies by the Centers for Disease Control and Prevention. What's the difference? The schools in the studies complied with the recommendations for layered prevention measures, making the schools safer than the surrounding communities. Even when disease transmission was relatively high in those surrounding communities, the schools were the safest places to be. And here's how they did it. More than 92% of their students wore masks. The students were physically distanced. The schools used quarantine measures after exposures. And they followed the basic principles of hand hygiene and environmental cleaning to prevent the spread of disease. All of these are effective, they're simple, and they are life-saving measures. It will help protect our students and teachers and allow them to focus on learning. It's impressive how effective the evidence-based measures are in reducing illnesses. And it inspires hope for us in South Carolina and the rest of the nation, even with the rise of the Delta variant. And of course, the absolute best protection is vaccination. We want as many people as possible to get vaccinated as quickly as possible. And I have said this hundreds and hundreds of times since December the 14th, when vaccinations first became available in South Carolina. That was the time that we all looked forward to with hope. High vaccination coverage is our only way out of this pandemic. I strongly urge everyone age 12 and above to get vaccinated. This prevents illnesses, it prevents deaths in those who are vaccinated, and it reduces spread to protect those who cannot yet be vaccinated because they're too young. So please, please, help us follow the basic principles of disease control. Please, we have to do more to bring this pandemic under control, and we have to do it now. The solutions are immediately within our grasp. They're simple, they're evidence-based, and we're asking people to simply comply with what will protect our students, our staff members, our healthcare providers, and our healthcare systems. Thank you.
Thank you. I'm Molly Spearman, State Superintendent of Education. I'm honored to be in this room with these dedicated folks who have given their lives to protect the health of our children in South Carolina, from Greenwood to Charleston, all over the state. Keeping South Carolina school open for in-person instruction for the entirety of 21-22 school year is crucial to ensuring the success of our students, many of whom missed a considerable amount of face-to-face classroom instruction over the past 17 months. We know that our students on average are already 3, 4, 5 months behind in where they need to be with their instruction. We recognize that prolonged individual student absences and closures not only disrupt academic learning and the services provided by our school system, but also the local workforce, the economy, mom and dad's ability to go to work that families rely on for their livelihoods. In order to keep our schools and classrooms open, students, parents, and educators must be vigilant in fighting this virus and doing everything within our power to create a safe learning environment where the virus is least likely to spread. As an educator, mother, now grandmother, a neighbor, a church member, I'll readily admit I'm not a health expert. So that's why I talk to my local doctors and these friends. And I've always trusted them, and you have too. We go to our doctors to give us health advice for our children. They've treated those who are sick, and above all else, have the best interest of South Carolina in their heart. Pediatricians, like all of these represented here today, play a key role in bringing up our children. We do it together, from treating their ears, diagnosing complex issues, like our mother has here today, serious illnesses like COVID. These professionals are trained and have a laser focus on child well-being, and I trust them unequivocally to provide sound advice to our families. Every parent, grandparent, guardian, caregiver should heed this advice today as you send your children to school. Take this virus seriously. I have friends and neighbors who are in the hospital right now because they refuse to take the vaccine, and their few words they can say is, vaccinate. We have to do what's right. If we fail to follow these mitigation strategies and use every tool available to us, I fear we'll be faced with a school year that we had hoped was going to be very normal, but with a school year with avoidable interruptions, which will be detrimental to our children. Folks, we're better than this. We're smarter than this. Parents, please listen to your doctors. Let's not go by what we read on social media. Let's do what these folks are asking us to do. Get vaccinated. Send your child to school with a mask on, not just for their protection, but for the community of children that they are in the classroom with. Thank you.
Thank you. We thank you all for coming, and we'd be glad to entertain questions.
Superintendent Spearman, I just came from a press conference with the governor in which I asked him whether or not he thinks lawmakers should come back and repeal the proviso that bans school districts from mandating masks. He said he still does not think that's necessary at this time. Do you disagree with him?
I have been very clear I do believe that this issue is best handled by local school boards. We have two ways now to make that happen. Either the legislature comes back in, and I have asked them to do that continually, or this ends up in the courts, and the courts resolve it. I disagree with the governor on this. We have got to have a solution to this. Our schools are starting, our educators are worried, and we have parents who are very, very concerned, as I am.
Superintendent Spearman,
Yes.
just to follow on that, can we have schools back to 5-day-a-week in-person learning without universal masking this year? Dr. Bell, if you wouldn't mind weighing in as well.
Well, we had hoped so, but obviously things have changed. This variant, as these doctors have explained, is different. And so far, we had 9 districts in for 2 weeks, and you see what's already happened. So those educators, you know, we have real life statistics to show now that it is spreading among children where it was not before. So I trust when they say we need to put masks on. And even with that, you know, we're not guaranteed that there won't be transmission, but at least we can say we're doing everything possible. So I do believe and that's why I'm here today, to say, yes, I think we need to put on our mask, and everybody who's eligible needs to get vaccinated.
Superintendent Spearman, if the
Wait a
government
minute, let me let Dr. Bell
Yeah, thank you.
follow up.
Thank you.
Let's hold mask mandate questions until these pediatricians can address the health-related concerns.
Well, sure. With regards to the mask, I mean, I've spoken to the basic principles of communicable disease control, and this is really what our role is at DHEC. And I wanted to mention that specific studies have been done that demonstrate that when we follow these basic principles, yes, we can have in-person school safely. The fact that the Delta variant is more transmissible doesn't mean that it's defeated by the masks. It means that it is spreading rapidly from person to person because the recommended standards, the recommended prevention measures have been relaxed. And so this is why the disease is moving so quickly. The vaccines that are currently available all offer excellent protection against the Delta variant. So the most important points are that we need to get a highly vaccinated population as quickly as possible. Masks are effective. We know that schools can be very safe settings when those layered prevention measures are practiced. And the kids have to wear masks, especially because a high proportion of all the kids who are not yet in middle school cannot yet be vaccinated. So they must be protected with masks. And yes, we can do this safely if we comply with the recommendations.
Let me put a little bit of a finer point on that also in terms of some numbers. At the height of the pandemic in January, the number of children that were reported to be COVID positive on a weekly basis, that height was 211,000. In June, late June I think the number is, it got to, nationwide it got to as low as 8,000. Last week was 121,000. So the relaxed measures are not working, and we need to protect our children. Other questions?
What are some of the, I guess, misconceptions or myths you guys are hearing, whether from patients, who have kids, about just, all these mitigation tools and why they're not opting for them, whether it's getting them vaccinated or having them wear masks?
Well, a couple things. The masks, there's obviously, masks we know are safe. Children do very well with masks. We heard from Ms. Jackson that her children do very well with masks. There's this myth that somehow masks destroy your ability to breathe and lead to too much carbon dioxide. That's not correct. So we know masks do provide vital protection. In terms of vaccine, again, there's lots of things out there. We could spend a whole press conference on those issues, but we do know that the vaccine is safe. I don't know what the most up-to-date number, but I heard Dr. Bell tell our statewide pediatricians 10 days ago that 8.9 million children across the country have been vaccinated. It's incredibly safe. And so we want, from a pediatric standpoint, we want everyone 12 and up to get vaccinated.
And Superintendent Spearman, kind of following on that, some states have now started to mandate either vaccines or regular testing for employees in school districts. Do you think school districts in South Carolina should consider doing that?
I'm going to turn to Dr. Bell to answer anything on vaccinations and requirements. Would you answer that?
Sure. So vaccination, we just want to follow the recommendations. You know, vaccinations are recommended for everyone over the age of 12 if you have the right product available. So mandating vaccinations is, it can be up to individual employers. You're talking about the setting. And I'm really focused on people following the recommendations, understanding what's available to them to prevent illnesses and to save lives and to stop the spread in the community. So, you know, my answer about vaccination mandates, I think we are coming to a point of personal choice, and we want people to have all the information, all the credible information that is available to them to follow what they can do to protect themselves, their families, people who cannot yet be protected by vaccination. It helps us all. We have to get high vaccination coverage and get to high herd immunity quickly. And I will mention the point that there's a lot of focus now on the Delta variant. If we continue to allow this variant to spread in the population, then we run the risk of the emergence of another variant to which the vaccine may not be effective. And then those options that are available to us now will be lost. So we have to do this sooner rather than later.
Has the Department of Education surveyed school districts to get any sense, any estimate of what percentage of employees are vaccinated?
Well, obviously, we are not able to ask folks if they are vaccinated or not. I have spoken with some superintendents, and they estimate we have some as high in the 80s, 80%. I spoke with a superintendent last night, and then we have others that may be right at 50%. But we do not have any definitive district-by-district information on that. There are a number of districts who feel so strongly about getting their employees vaccinated that they are offering incentives for their employees to be vaccinated, which I fully support.
And Superintendent Spearman, if the government does decide that they want to cut funding for schools and have defied the proviso, will the Department of Education have any role in either facilitating that or blocking that?
Well, let me be clear. If you read the proviso, it is silent as far as any consequences. Precedent has that when a district may use funding improperly, they have to pay it back. So we'll be looking into that over the next few weeks. But if you read the proviso, it is silent. I'll say I fully support that this decision should be made at the local level by school boards. They know best, they can act quickly, and although I am a state constitutional officer and I took an oath to uphold the law, so I will be reminding those districts of the law and uphold it, but there is no penalty written specifically on this proviso about mask wearing.
Superintendent Spearman, there is another budget proviso that kind of has repercussions if school districts were to cross it. There is a 5% threshold on virtual learning, and now with Pickens County switching to online learning, what clear messaging should school districts be looking at?
Okay, let me explain this just a bit. We interpret the proviso that you're mentioning that says no more than 5% of families or students can participate in virtual learning. We interpret that as virtual learning when a family has decided that they will permanently participate in the virtual program that's being offered, whether it's by semester or year. So that's where we'll be calculating those numbers. This temporary virtual that Pickens has done, we do not consider that as part of that proviso. So there would be no financial penalty there for those districts.
Superintendent Spearman, a new survey shows that South Carolina ranks in the bottom 10 for financially recovering from the pandemic. What role, if any, do you think implementing protocols, safety measures in schools will help the state recover?
Yeah, I'm not familiar with that study, But I will say this, we all know how important the South Carolina economy is to all of us. And we all know that having schools face-to-face is a huge piece of that. And we were very fortunate that many of our schools, so we had 15 districts who didn't miss a single day last year. Most others got back into school as quickly as they could. For many reasons, we want our students back into session. And that's why South Carolina's economy did not suffer so much last year, because we were in school. That's one more reason why we need to get vaccinated and to wear our masks so that we can have a normal year. So the school plays a huge part of the economy of the state. And that's what, actually, the academic part, obviously, the social emotional well-being of our students for being with their friends, but also to the economy. It's a huge piece of that.
Does anyone have any other questions for Dr. Bell or the pediatricians? I know they've got busy schedules, so let's get their questions done. We can do the superintendent.
To one of the pediatricians working in ICUs, if you may, what is it looking like right now, and are the cases that you're seeing of children in ICUs predominantly COVID now versus the other respiratory viruses we were talking about?
So I don't work in an ICU, but I do work in a hospital setting. And so with an increase in cases, some proportion of those children will be sick enough to come to the emergency department. Some of those will be hospitalized, some of those will be critically ill and in the ICU. So as we see these cases rise, we are seeing that. One of the things that concerns us is we're seeing it on top of a really busy respiratory viral season right now, and all of the other things that bring children to the hospital on a normal daily basis, and we're layering that now with respiratory viruses, including COVID.
And to follow up on that, let me introduce Dr. Elizabeth Mack, who is a pediatric intensivist in Charleston. She's the vice president of the chapter.
Hey there. So this has been quite different than the last wave. Our children are suffering significantly. Prior waves, typically what we saw was MIS-C, the multisystem inflammatory syndrome in children. Now we are seeing acute COVID in a very different way. These children are presenting with very severe presentations. As you saw in national news, we have recently had a death. Obviously, this is of significant concern, and many, if not all, of the ones that we have taken care of have been unvaccinated. And part of that is because several of them have been too young to be vaccinated, as Dr. Bell and Superintendent Spearman alluded to earlier. So incredibly important to protect our younger children by our older folks, 12 and up, getting vaccinated and masking for the protection of the younger children's sake.
Dr. Mack, just to clarify, what you're saying is that it's not just MIS-C that's a threat to the children. The Delta variant itself is a bigger threat to children.
Correct. Acute COVID has been very severe for those that have been hospitalized this wave. This is very different than what we saw before.
And Dr. Bell,
Any other doctor questions?
Yeah, for Dr. Bell, putting on the state epidemiologist hat, when it comes to, we've mentioned a lot of these temporary laws and provisos, are there any specifically you would like to ask the General Assembly to work on now to repeal?
Well, excuse me, it's not my role to work with the General Assembly, I guess, in the way that you're suggesting. What we do, though, is make sure that our legislators, our elected officials, have the most current guidance. As CDC changes their guidance, as they did because of the surge of disease nationwide, this is why the CDC made the most recent changes for school guidance on August the 4th. So our role is to make sure that we keep our legislators informed about the guidance that's available, guidance that is based on science, guidance that is based on evidence, and hope that they will use that information to best protect the population and those that they represent.
And as schools like those in Pickens County go to virtual, is DHEC advising them in any way about when is the time to go to virtual because of high cases?
So no, DHEC does not have a role in saying when schools will start or when schools will go virtual. We similarly work with schools to make sure that they have the guidance. DHEC does have exclusion criteria for communicable diseases. so that when people are diagnosed, staff or students are diagnosed with a variety of diseases that could be a potential threat to the public, then they must be excluded from the school environment, and this is why we're also implementing the isolation measures for positive cases and the quarantine measures for the close contacts. And the more cases that we see like that, that obviously has a risk of disrupting the school environment if we have far too many cases that need to be isolated. And with the transmission of the Delta variant, far more students and staff who must be quarantined so that they can't spread the disease before they may be recognized as being cases. And that's DHEC's role.
Dr. Bell, kind of going off that question, does DHEC have the ability to issue an emergency mask ordinance for schools? And if so, would you guys be considering that at all?
No, we do not.
Dr. Bell, is there a way to define when schools can go back into in-person learning?
We focus on the individual cases, and we do contact investigations around those cases. So our preventive measures focus on the individuals. Our recommendations focus on guidance for the schools to implement. And so that, you know, whether or not schools are in session, and recommendations along those lines do not come from DHEC.
All right, thank you all. We can take a couple more questions with the superintendent here if we have them, but I think we're gonna let these doctors.
Again, thank you for coming. We appreciate your efforts in terms of getting the message out. We want to, we hope the trusted message from the doctors becomes accepted policy and moving forward. Thank you.
Thank you.
Superintendent Spearman.
Let's like one thing about the.
Yeah, thank you all so much.
Yeah, just, we'll do like two or three more of these.
Thanks for sticking around with us.
Sure.
It's the first day of school for many districts this week, today. With schools not being able to mandate masks, do you think parents should feel safe sending their kids to school right now?
I will say that schools are doing everything they possibly can with social distancing. We are encouraging our employees and those students who are eligible for the vaccine to work with their doctors to get vaccinated. We're cleaning the buildings, trying to maintain the social distancing as much as we possibly can. So I would say optimistic, cautiously optimistic, not as optimistic as I was this previous year, because we all know that adding this piece is in the order of importance. Number two, vaccination is one, wearing masks is number two. Now, I have been in contact with superintendents all over the state. In some communities, they're as high as 90. One superintendent told me this morning probably 97% of his students had masks on yesterday. In others, it's very, very low. So it depends on the community.
How is the department prepared to, if other school boards follow the lead of Charleston County yesterday, how are you all prepared to handle if other school boards decide to make the same decision with mask mandates?
Well, I'm in constant communication with them. We will be investigating if and when, if there are consequences. I've made it clear that I agree with them that the decision should be at their level, but I will be reminding them of the law. And none of us want lawlessness. We want order. That's what educators are about. But these are very, very difficult decisions folks are having to make. So I need and have asked, as I said earlier, I see two ways of this being solved. Either the legislature comes back, and I know many of them want to do that, or this goes to court and the court settles the question for us as to who has the ultimate authority on the safety of children during a pandemic.
One more question.
And on absences, when it comes to back to school, how will those be handled for students, and are there any guarantees to staff that they won't be needing to use their PTO because of quarantining?
I know that many districts are, this past year and are continuing this year to use their ESSER, their federal funding, to cover additional leave days for their staff. So I'm sure many of them will have that in place. As for student absences, we are working now with districts. When students are quarantined, now with our technology, many of them can complete their work, and if they're able to complete their work, it will not be counted as an absence. So we're working individually, and thankfully our technology access has improved. So hopefully as students do have to go home, that they can get their work done, and that will not be an issue. The issue is that we know they do better when they're in the classroom with a teacher, and that's what's so sad, that so many of them are having to go home. Yeah,
Thank you
let's-
all. That's it for right now. How frustrating is it for you to see this play out the way it's playing out right now?
I'm very concerned. I don't know that I've ever been this concerned, and my heart is very, very heavy for the difficult decisions that educators are having to make.
Thank you, guys.
Thank you.
Snuck that in there, yeah.
Gavin, I like you a lot. Sorry, Ron.
All right, folks.
All right.
Let me roll, let's get the, I'm grateful for me.
They have our sound